So now we're going to run through a clinical scenario in general mode. So we're going to pretend that we have a 1-year-old that's hypoglycemic, has a blood glucose of, we'll say 45, and you need to give this kid D10. So the first question is, how much D10 do you give? The first thing that came to your mind when you're thinking about how much D10 you need to give is that you would consult the Hantevi book. So we're going to look back in our Hantevi book. We're going to look up and see that we have a 1-year-old. So we're going to look up here, 1-year-old. Ideal body weight is going to be 10 kilos. And before we even think that we might have to do math, we remember that Hantevi does all of that for us. So we come down here, we find the D10, and we see that we're going to give a total of 50 mLs. Now, if we think about giving 50 mLs of D10, D10 is in a 250 bag. So, we have a couple of options. We could try to just open it up and look for the line markings, but that's not a very confident way of doing it. We could start drawing it up in the 10 cc syringes, but that definitely seems cumbersome, and I know I would get confused about how many I had given if I kept trying to draw it back up or not. So the pump is definitely going to be our friend when we want to give 50 mLs of D10 to our 1-year-old. How are we going to do this on the IV pump? Once we have our D10 line is flushed and our D10 is hooked up, we're going to go into Choose General. Confirm we're going to bypass the specifics. We're going to do mLs. Always do no to weight-based infusions. And on this screen here, you can do mLs per hour or mLs per minute. It makes no difference at all which one you click. All right, but now we get to this screen here. And remember that anytime we see this screen, we want to enter 2 out of the 3 items. So do we know what our rate is? Do we know how many milliliters per hour we want to run D10? Without doing math, I don't know how many mLs per hour we want to run this D10. We just know we want to get 50 mLs of it, and we probably want to give it pretty quick. So when it comes to rate, we don't know that. So we have to enter 2 out of the 3 items here. So let's cross out rate because we don't know that one. Do we know how many our total volume to be infused? Now, keep in mind that when we were doing this before, when we were doing our drips, our total volume to be infused, we gave the size of the bag because the pump was doing that math for us, and we entered in a rate. This time, we don't know the rate, but we do know how much we want to infuse. We know that we want to give 50 milliliters, right? So if we know we want to give 50 mLs, we're going to check this one off because we now know the volume to be infused. Don't be confused that you have 250 mLs of liquid in the bag. You know you want to give 50 mLs of that. So your volume to be infused, your total volume to be infused is 50 mLs. Do we know how quickly we want to give it? Well, there's no set rule to how quick we need to give it, but we know we want to give it fairly quick, right? So we can say yes, we know the time. The time we want it to be as quick as we can. So the 2 out of 3 that we're going to enter, one must go, rate's going to go, and we're going to keep volume to be infused and time as our items we are going to enter. So we're going to go into the pump. We know our rate we don't want to do. We cross that one off, volume to be infused. We know we want to give 50 milliliters of D10. So we're going to put our 50 in. And when we're going to select time. Now when we bring time up, we just said we want to give it as quick as we can. We don't have a precise amount of time we want to give D10 over. So if you look up in here in the top right hand corner, there's a range. Anything in red in the top right hand corner is always your range. You can administer this D10 anywhere from 99 minutes, actually that might even mean 99 hours, all the way down to 4 minutes. All right. The lowest value that's up here in red, which is going to be this one right here, is the quickest amount of time the pump will allow you to give the volume of fluid that you want to give. All right. So if we're giving a fairly small volume, we're only giving 50 ml. So the pump says, yeah, I can crank that out in 4 minutes. Let's pretend you wanted to give, maybe you weren't giving D10. Let's just pretend for a minute you wanted to give this kid a fluid bolus because this kid was hypovolemic, and you were going to give this kid a 200 ml fluid bolus. And say you're like, yeah, this kid looks sick. I want to give it really quick. I'll try to give it in 5 minutes. The pump's not going to let you do that because it can only give the fluid in a certain amount of time. If you're trying to tell it to infuse faster than the pump is able to, it won't accept that. And when the way the pump doesn't accept something is a little button that should be right here that says next, it just takes it away. It makes it disappear. So always remember that the fastest you can give a certain amount of fluid is the number in the top right hand corner to the left. So in this case, we decided we were going to do it over 10 minutes. And you can see as soon as we entered an acceptable range, let's go back here a little bit. As soon as we entered an acceptable range for the pump, this OK button appeared. All right. Prior to us entering an acceptable range in the pump, the OK button was not there. So if I'm back here, the OK button's gone. When I enter the acceptable range in, the OK button appears. If I would have entered in and I said I wanted the pump to do this in 3 minutes, which it can't do, it would not have given me the OK button. So if you're ever trying to advance and you don't have the OK button, the pump's not happy with what you put in, and you need to check whatever's in the top right-hand corner there. Reconfirm everything, and start. And again, we're going to get that infusion near end message. What this infusion near end message is saying is that the infusion is almost done. Well, we're giving a small infusion, so we know that. But the pump will come out as a certain predefined time, and I don't remember how many milliliters it is, but at a certain amount of time, maybe time before the end of your infusion, it will come up and warn you that your infusion is almost done. When you're giving a small amount of fluid like this, like 50 mLs, the pump is realizing that you're almost done before you even start. So when you see this warning come up, just click the you got to click the mute button first. So the first thing that'll come up, you'll see there is no OK button. There is no button down here. This button is missing. We need to get that button back so we can continue. And the way you do that is by clicking the mute button here. Once you press the mute button here, the next button there will continue. So let's see how that works out. We press mute. As soon as we press mute, the OK button appears, and we can move on with our infusion. All right, so let's look at another scenario in general mode again. We're going to pretend that we have a patient who presents in ventricular tachycardia, but they are stable. You make the decision that you're going to manage this patient with amiodarone. You're going to give this patient a 150 of amio. And the question I want to ask you is, if this patient is in ventricular tachycardia, you are giving them amiodarone to get them out of ventricular tachycardia, are you giving the patient a bolus or an infusion of amiodarone? I hope everybody said a bolus of amiodarone. Because you're giving a bolus, can you still use the pump? Yes, you certainly can still use the pump. But when we're giving boluses of medication, what mode do we do it in? And that's general mode. So when we're setting this up, this one is a little bit more complicated. When we're giving a medication in general mode as a bolus, we only want to put the quantity of medication in the IV bag that we want to administer to the patient. So we never want to put more volume in the bag than we plan to administer if we're using general mode, if we're using a bolus. So in this case, our patient's in ventricular tachycardia, and we know that if the patient's stable, then we're not going to cardiovert the patient right away. The next intervention is going to be 150 milligrams of amiodarone, and that should be given over 10 minutes. So you could take your syringe here, draw up your amiodarone, and then you could push it over 10 minutes. That would be, you could do that. There's nothing wrong with that. If you think that's kind of cumbersome and it's going to really be hard to count out your 10 minutes while you're doing that, you can also employ the IV pump to help you do that. And to do that, what we're going to do is we're going to take this 150 of amiodarone, and we're going to put the full dose of that into our 100 bag. All right, so we want to draw it up, put it in there, put a label on it. So we're going to take 150 of amiodarone and put it in our 100 bag. We're putting the full, in this case, all right, so we put the full 150 milligrams, because that is our dose, is going to be 150 milligrams. We put it into a 100 ml bag. And then we are going to run that in general mode. All right, I think everybody's good with how to get to general mode on the pump. So let's just look at a screenshot of our pump here real quick. And let's remember, let's put our pump right next to our IV bag so we can see everything at once. All right, so we know we have put our amiodarone. All right, amiodarone's hiding back there. And we know that our amiodarone is in our 100 bag now. And we need to put that into the pump. How are we going to do that? So we got into general mode. And remember, we always have to pick 2 out of the 3 things here. We have 2 out of 3 options. One of them must go. And we're going to enter the other 2 in. So let's look at this and say, well, do we know the rate? If we know we want to give this 150 of amiodarone, which we put into 100 mLs, and we want to give that over 10 minutes, do we have any idea how many milliliters per hour that is? If you figured that out in your head that fast, then go for it. But the most of us are thinking, no, we don't know what that is. So we're going to cross that out. We're going to say, I don't know how many mLs per hour I want to give here. Do we know our volume to be infused? The answer is yes. We know all of it. We want to give the full 150 milligrams, and that's going to be 100 mLs. So we know that we want to do, oh, I really can't draw with a mouse. There we go. We want to do 100 mLs. Is going to be our volume to be infused. And do we know how long we want to give this? Yes. We know that we want to infuse this amiodarone over 10 minutes. So we can put our time in here to be 10 minutes. And then the pump would accept that and we would go. So when we're doing an amiodarone bolus, we are going to do a 150 milligrams in 100 mLs. We're going to stay in general mode, and we're going to come right on over here, and we're going to enter this in general mode and tell it to give it over 10 minutes. If we had a scenario though where we had this and we converted this patient out of ventricular tachycardia, and we spoke with our medical command physicians, and the decision was made to put the patient on an amiodarone infusion, what would that look like? Well, what we would do then is this part would look very similar. We would still take our 150 of amio and put it into a 150 bag. I'm sorry, 150 amio and put it into a 100 bag. So this part would still look the same. However, instead of running it in general mode, we would then run that. My pen here instead. We would run that in the medication mode under amiodarone infusion. And once you would get in there, you would see that the amiodarone infusions are always run at the same dose. We always run the amiodarone infusions at 1 milligram per minute. So the amiodarone bolus is going to be our 150 milligrams in general mode over 10 minutes, and our amiodarone infusion is going to be our 1 milligram a minute continuous infusion. And if we go back to that clinical scenario that we have the patient who was in ventricular tachycardia. All right, and just because the amiodarone on the pump can be a little bit confusing since we have 2 different ways we're administering it, let's run through this one more time. We have this patient here, and we'll say this patient presents in ventricular tachycardia, but they are they're stable. We make the decision that we're going to treat them pharmacologically. They don't have any indications for immediate cardioversion, and we know that the medication that we're going to give is going to be, we got to get my amiodarone over here. All right, it's going to be amiodarone. So we're going to look at this amiodarone, and we're going to say, all right, well, we know we're going to mix that in a 100 bag, because we've done that for every route that we've done amiodarone so far. So let's just take that here. We'll put our amiodarone into our 100 bag. And now we know that this patient has a pulse, but we want to give them amiodarone. We know that we want to give amiodarone at a rate of 150 milligrams over 10 minutes. So let's look at our different pump options here real quick. Let's bring this guy down here, and our other pumps over here. All right, so which option are we going to do? We have this one over here is our general mode, and this one over here is going to be our medication library. So if our patient is in VTAC right now, and we're going to give amiodarone to try to convert them, that's going to be the bolus. We're going to be giving a bolus of amiodarone. So hopefully you recognize right away that if we're going to do a bolus of amiodarone, we are going to be looking for this screen here, and this is going to be in general mode. So we would find this screen here. If you need to go back in the other videos, go back and take a look under general. So that's where we would be putting in here. We'd be looking for that general screen. And we are going to look at this and we say, all right, I need to enter in 2 out of the 3 data points here. So what are our 2 out of 3 things that we're going to enter? So do we know the milliliters per hour we want to run that? No, we just know we got this patient that's in VTAC and we want to give them 150 milligrams of amiodarone over 10 minutes. So we don't know mLs per hour. So let's cross that one out. Do we know our volume to be infused? Yes, we have a 100 milliliter bag and we put 150 milligrams in there, so we want to give the whole thing. So we're going to say yes, we want to give, our volume is going to be 100 mLs. And do we know how long we want to give it? Yes, we want to give it over 10 minutes. All right, so excellent job. You started out, you had this patient who was in VTAC. We gave them amiodarone. We converted them back to this sinus tachycardia here. And we contact medical command docs. We discuss it, and the decision is made to put the patient on an amiodarone drip or an amiodarone infusion. So we're going to come down here, and we're going to say, all right, well, we're going to mix that the same way again. We're still going to put 150 milligrams into 100 mLs, but we now want to infuse an amiodarone infusion. And we think back and we're like, oh gosh, what's the dose on that? So we can look back on our cheat sheets, and we know that our amiodarone infusions always run at 1 milligram per minute. So if we were to try to do that with this option over here, the same mode on the pump that we ran our amiodarone bolus, we would look at this and say, wow, there is no option on here to set this up to run it at 1 milligram a minute. I don't know how we're going to do that. And this is an infusion, so we always want to be in the medication library anyway. So we're going to X this side out. We're not going to use this. This is our general mode. That worked great for our bolus, but when we want to go to doing our infusion, we want to go into the medication library. So when this time we're going to take our amiodarone and we're going to go into the medication library and into amiodarone infusion right up here. And if you were to open up amiodarone infusion, it would be just like the EpiDrip. It would come up and it would ask you for the dose, and the only acceptable dose you can put in is 1 milligram per minute, because we know that that 1 milligram per minute dose is always what we run our amiodarone at. And it would have you go through and just confirm all the information just like we did in our other medication library exercise. So just again, amiodarone has 2 options. In this case here, where we had the patient who we wanted to, out of a ventricular arrhythmia, and we wanted to put them on an amiodarone infusion to hopefully keep them from going back into their ventricular arrhythmia. In those cases, we are going to do the medication library. We're going to go in and enter it in. In our cases where we want to have a patient who is in a ventricular arrhythmia, and we want to give them amiodarone in hopes of getting them out of that ventricular arrhythmia. Then we're going to come back over here, our one we X'd out before. So let's grab our patient that was still in VTAC here, and they're going to be run in general mode. We want these patients who still have arrhythmia, they're going to be given a bolus, and we do that in general mode. And again, here's our amiodarone bolus in general mode. We're going to go back in and accept again. New infusion. Choose general. Acknowledge we're removing the safeguards of the pump because we're not doing a long-term medication infusion. Weight-based is going to always be no. Our volume to be infused, as you just saw, was going to be 100 mmLs. And we're going to administer that over 10 minutes.